How do sonographers identify organ systems for imaging? Imagine stepping into a vast and complex city, where each neighborhood has its own unique layout and landmarks. Sonographers, or ultrasound technicians, navigate this intricate city of the human body by recognizing specific landmarks and patterns to identify different organ systems. Their goal is to produce clear images that help in diagnosing medical conditions accurately. The process begins with a thorough understanding of human anatomy and physiology. Sonographers study detailed anatomical charts and use their knowledge to anticipate where organs are located within the body. They learn common anatomical landmarks, such as bones, muscles, blood vessels, and other tissues, which serve as guides to locate specific organs. For example, when imaging the liver, sonographers look for the right upper quadrant of the abdomen, using the ribs and the right kidney as reference points. To identify organ systems, sonographers employ a systematic approach called the scanning protocol. This involves starting with a general overview and then narrowing down to specific areas. They often begin with a broad scan to get an overall picture and then adjust the probe's position, angle, and pressure to focus on particular structures. For instance, when examining the heart, they use the chest wall as a starting point and then locate the heart within the thoracic cavity by identifying the pericardium, chambers, and major blood vessels. Color Doppler imaging is another vital tool that helps sonographers differentiate blood flow within vessels from surrounding tissues. This technique allows them to visualize the direction and velocity of blood flow, confirming the identity of blood vessels within organ systems. Recognizing characteristic flow patterns helps distinguish arteries from veins and confirms the presence of specific organs. Sonographers also relying heavily on real-time imaging and their experience to recognize typical shapes, textures, and movement patterns of organs. For example, the smooth, homogeneous appearance of the liver contrasts with the more complex, layered structure of the intestines. By combining their anatomical knowledge with imaging techniques, sonographers can accurately identify and differentiate between various organ systems. In addition, patient history and clinical information provide context that guides the sonographer's focus. Knowing the reason for the scan, such as suspected gallstones or kidney stones, helps target specific areas and organ systems for detailed examination. Overall, identifying organ systems for imaging involves a blend of detailed anatomical knowledge, systematic scanning techniques, advanced imaging tools, and experience. This comprehensive approach ensures that sonographers can produce precise images that are essential for accurate diagnosis and effective patient care.